Hello, and welcome. Today we're diving into a complex and often challenging neurological condition called mononeuritis multiplex. This disorder can significantly impact quality of life, so understanding it is crucial. We'll explore its causes, how it affects the body, how it's diagnosed, and what treatment options are available. Join us as we unravel the complexities of mononeuritis multiplex. Mononeuritis multiplex isn't caused by a single specific factor. Instead, it typically arises from underlying systemic conditions that damage blood vessels, particularly those supplying nerves. Think of it like this: if a nerve's blood supply is cut off, it can't function properly. Common culprits include vasculitis, such as polyarteritis nodosa, where blood vessels become inflamed. Autoimmune diseases like lupus and rheumatoid arthritis can also trigger it. Less common causes include infections like Lyme disease or hepatitis, sarcoidosis, and even certain types of cancer. In some instances, the exact cause remains a mystery, categorized as idiopathic. The underlying mechanism of mononeuritis multiplex revolves around nerve damage, or neuropathy. The vasculitis, inflammation, or other underlying disease process damages the small blood vessels, vasa nervorum, that supply individual peripheral nerves. This damage reduces or completely cuts off the nerve's oxygen and nutrient supply, leading to ischemia. The nerve fibers then begin to degenerate, disrupting the transmission of signals to and from the brain. Because the condition affects multiple, non-contiguous nerves, the symptoms manifest in seemingly random patterns throughout the body. Pinpointing the exact prevalence of mononeuritis multiplex is tricky because it often occurs as a complication of other diseases. It's considered a relatively rare condition. The overall occurrence is closely linked to the prevalence of its underlying causes, such as vasculitis and autoimmune disorders. It can affect individuals of any age, but is more commonly diagnosed in middle-aged and older adults, which often mirrors the age of onset for many of its underlying conditions. The symptoms of mononeuritis multiplex are quite variable, depending on which nerves are affected. Because it involves multiple nerves in different areas, symptoms typically appear in a scattered or asymmetrical pattern. Common symptoms include pain, which can range from mild aching to sharp, shooting pain. Muscle weakness is another frequent manifestation, often affecting the hands, feet, or limbs. Sensory changes are also typical, including numbness, tingling, burning sensations, or a decreased ability to feel touch or temperature. In severe cases, muscle atrophy can occur due to prolonged nerve damage. The symptoms can develop rapidly or gradually progress over time, and they may fluctuate in intensity. Diagnosing mononeuritis multiplex requires a thorough evaluation, combining clinical assessment with diagnostic testing. A detailed medical history is crucial, focusing on potential underlying conditions. A neurological examination will assess muscle strength, reflexes, and sensory function. Nerve conduction studies and electromyography, EMG, can help identify the extent and location of nerve damage. Blood tests are essential to look for markers of inflammation, autoimmune diseases, and other potential underlying causes. A nerve biopsy may be necessary to confirm the diagnosis and identify the specific cause of nerve damage. Imaging studies, such as MRI or CT scans, might be used to rule out other conditions and assess for vasculitis or other structural abnormalities. While mononeuritis multiplex isn't formally classified into distinct subtypes, it's often categorized based on the underlying etiology. For example, we might speak of mononeuritis multiplex secondary to vasculitis, or mononeuritis multiplex associated with diabetes. Understanding the underlying cause is vital for determining the appropriate treatment approach. The primary goal of treatment is to address the underlying cause of the nerve damage. If vasculitis is the culprit, immunosuppressant medications, such as corticosteroids and cyclophosphamide, are typically used to reduce inflammation. For autoimmune diseases, medications like methotrexate or azathioprine may be prescribed. Pain management is another crucial aspect of care. Medications like gabapentin or pregabalin can help alleviate nerve pain. Physical therapy and occupational therapy can improve muscle strength, range of motion, and overall function. Assistive devices such as braces or splints may be needed to support weakened limbs. In some cases, surgery may be necessary to relieve nerve compression or repair damaged nerves. Because mononeuritis multiplex often arises from underlying systemic conditions, prevention focuses on managing those conditions effectively. This includes controlling blood sugar levels in diabetes, managing autoimmune diseases with appropriate medications, and preventing infections through vaccination and hygiene. Early diagnosis and treatment of underlying conditions can help prevent or minimize the risk of developing mononeuritis multiplex. The prognosis for mononeuritis multiplex is highly variable and depends largely on the underlying cause and the severity of nerve damage. Early diagnosis and prompt treatment of the underlying condition can improve outcomes. Some individuals may experience significant recovery of nerve function, while others may have persistent symptoms. Ongoing research is focused on developing more effective treatments for the underlying causes of mononeuritis multiplex, as well as strategies for promoting nerve regeneration and reducing pain. Specific research areas include targeted therapies for vasculitis, novel pain management techniques, and regenerative medicine approaches to repair damaged nerves.